Survivors don't necessarily go through treatment.
We've honored them with all the things that we've done for them and with them.
They are Stacy and Michael Garil, the children of Ethel and Bernard Garil, a family cut in half by cancer. This is the story of a courageous son who lived and died from long-term effects of his cancer treatment, and his parents, the survivors, who established the Michael J. Garil Leukemia Program, supporting the research to better understand what can happen after so much treatment. Surviving cancer is just the first step. Photos help the heart remember. There was day camp.
What do they call that? Tomahawk Parade or something?
Yeah,
like
that's
that?
what I think it was, the Tomahawk Parade.
An athlete in the making.
That's my favorite picture.
This one, yeah?
Yeah, I love that picture. Michael posing with his little soccer ball and you and I behind him.
A handsome young man.
That was Michael
like
at his prom.
And a proud brother standing as best man at his sister's wedding.
You couldn't have picked a better guy. He's a diehard Dallas Cowboy fan like myself. And finally, I have somebody to go up against my father, who's a Redskin fan. All the happiness, congratulations. I love you both.
Snapshots of a normal life? Not exactly. Too many strep throats and low-grade fevers landed Michael Garil in the doctor's office when he was just 7 years old. Leukemia would be the diagnosis. Life in the Garil house would change forever.
It was scary. Really scary.
It was day to day in our minds, hoping that he would survive.
We tried to keep it as normal as you could do with a non-normal situation. And I think we basically did.
The other issue was he had a sister who was 3 years younger than him, and she really became a second child. As much as we loved her, and Michael was the priority.
His was a constant battle, in and out of hospitals and endless treatments.
He was on chemotherapy for 7 straight years with a 3-month break at one point before he relapsed the first time. And then went through a bone marrow transplant, which involved deadly doses of chemotherapy and radiation.
The result of that powerful medicine may have cured Michael's leukemia, but he would experience what is now called late effects of treatment. His parents remember signing a medical release listing extreme conditions that could possibly occur, worst-case scenarios.
In Michael's case, it was like you could start checking them off.
Diabetes, brain tumors, mouth and jaw tumors, and kidney failure. The list was tragic. But he met each challenge with courage and humor.
Michael did not share his burdens with others, but lived as much as he could a normal life.
And while Michael was fighting to live a life, the Garil family would take on cancer again. Their daughter Stacy would succumb to breast cancer. 8 years later, Ethel and Bernard Garil would bury Michael. But his 31-year battle against cancer and its demons created by long-term effects of therapy would not be in vain. They have established the Michael J. Garil Leukemia Survivors Program at the Kimmel Cancer Center at Johns Hopkins.
What do you think about all this?
The Garils know firsthand. Patients with leukemia receive aggressive treatment to survive this disease and are at risk for serious complications and late effects of treatment. So this survivorship program screens these patients, enabling doctors to anticipate health problems and treat them early. The program also supports research to better understand the long-term effects of these therapies. The Garils didn't stop there. To honor their daughter Stacy, a memorial fund summer internship award at Johns Hopkins in cancer research is offered to Brooklyn College students.
Hopefully, both of them looking down on us will be proud of us just as we were proud of them for what we're doing in their memory.
Because that's what survivors do.
I knew medicine was my calling, but I really didn't know what my specialty would be until my third year of med school when I was assigned to a pediatric oncology rotation. My life changed that day. It was one of the strongest gut feelings I've ever had. I met these amazing kids fighting for their lives with a maturity way beyond their years. I wanted to help. I hoped I could help. That was 15 years ago. I'm Pat Brown, and I'm the director of the Pediatric Leukemia Program here at the Kimmel Cancer Center at Johns Hopkins. My primary area of expertise is leukemia, or blood cancer, which is the most common form of cancer in kids. Jackson, how's it going? Like all of the doctors at Johns Hopkins, I'm a physician, a researcher, and a teacher.
Day one of
I am very lucky to lead a dedicated and talented team of lab researchers trying to develop new and improved treatments for children with leukemia. Cancer is so tough to conquer because every cancer cell is driven by changes or mutations in several different genes. These mutations are what causes this deadly and destructive disease. Our challenge, our quest, is to find a combination of drugs that target these mutations to kill the cancer cells but leave the normal cells unharmed. The Children's Oncology Group, an international network of researchers and hospitals, has appointed me to lead the first clinical trial testing a new treatment that includes a novel drug developed in our laboratory. This drug targets mutations in a gene called FLT3, an important cause of blood cancer. By focusing on therapies that specifically target cancer cells, we are hopeful that this new treatment will not only cure more patients, but will do so with fewer of the side effects commonly seen with chemotherapy. In the Children's Oncology Group network, over 90% of leukemia patients are treated through the clinical trial process. These trials are the only way to know if a new treatment will actually cure more patients. A treatment that is successful in a trial then becomes the standard treatment for kids suffering with cancer. Over the last few decades, these clinical trials have changed leukemia from a disease that killed 100% of patients within a few weeks to one where most kids are cured. That is pretty amazing. I feel privileged to play a role in this process and incredibly grateful for the courage our patients and their families show when they agree to participate in these trials.
And you said Dad's feeling okay?
Yeah, Dad's feeling great.
Well, he should be very proud of himself for donating bone marrow for his boy.
Yeah.
Treating children with leukemia is a tremendous responsibility that I do not take lightly. While we work to develop new and better approaches to treatment, we do everything in our power to protect every patient and offer only treatments that we believe in our hearts will help. These amazing kids deserve nothing less. I'm Pat Brown, Director of the Pediatric Leukemia Program here at the Kimmel Cancer Center at Johns Hopkins.
Watching the research that I do in the lab translate into clinical trials, then translate into long-term survival for many childhood cancer patients, tells me every day I made the right choice in becoming a pediatric oncologist at the Kimmel Cancer Center here at Johns Hopkins. I'm Heather Simons. Do you know the most common form of childhood blood cancer is leukemia? This is a cancer that starts in the bone marrow where new blood cells are made. In many instances, we need to treat our young cancer patients with a bone marrow transplant. This can actually cure the disease.
All set.
If that sounds easy enough, it isn't, because we often have trouble finding an exact bone marrow match, even when we test close relatives like siblings or look for an unrelated match donor. An exact match is often not found. But here at Hopkins, our team has discovered a new way to deliver bone marrow transplants. Do you feel dry inside your mouth? Like your tongue is dry or?
Yes.
Yeah?
A little at the moment.
Okay. Now, many more childhood leukemia patients are able to receive this curative treatment. We use half-match donors rather than a full match and still give patients the effective treatment they need. We call this a haploidentical transplant, and it has revolutionized bone marrow transplantation. It has been a particular challenge to find a fully matched donor in the national and international registries for patients of African American descent and other minorities, putting these patients at an increased risk of not being able to get a bone marrow transplant. Finding a half match is much easier since most children have a half match parent or sibling. Half-match donors make it possible to treat many more patients with childhood blood cancers. This therapy is saving lives.
I mean, it's winter. Skin's just dry.
Did you have this before transplant?
What? A little bit, but not to the same
Not as
extent.
much. And it doesn't stop there. Half-match bone marrow transplants are being used in earlier stages of leukemia and other blood cancers, and we're exploring its use for children with solid tumor cancers and non-malignant blood disorders like sickle cell disease. I'm Heather Simons, a childhood cancer oncologist at the Kimmel Cancer Center at Johns Hopkins.
The Life Clinic at the Kimmel Cancer Center at Johns Hopkins.
The Life Clinic is where someone who's been treated for cancer comes to make sure that they have the best possible health outcome that they can and the best possible quality of life that they can.
Hello, dear. Hello. How are ya? Very good.
They learn about their treatment and what they're going to do with the rest of their life. After you've had these really toxic treatments, sometimes chemotherapy, radiation, there are long-term complications. We know that 2/3 of childhood cancer survivors will have at least one long-term complication related to their therapy, and about 1/4 of them will have a severe life-threatening long-term complications, and these are things that need to be monitored for years, even decades after their treatment is completed.
How many hours of sleep do you think you get a night?
As much as you let me.
Okay.
Now, 8 hours definitely.
Beautiful.
Yeah.
Once you get to the survivorship period, it's really time to sit down, take a full assessment of what you've gone through, and what that means for your health and for the rest of your life.
Okay, I'm going to start off by taking some images on your stomach there. Then I'll move over to the left side of your chest, the middle of your chest, and your neck.
The first thing that I do is a lot of homework before they ever get to my office. And I look at their records and I total up all the treatment that they had. Look at what age they were when they were treated, any toxicities or complications they had during the treatment.
That circle in the center there is your left ventricle.
And we use that to forecast what might be expected to happen in the future and what kind of things need to be monitored for over the long haul.
Follow my finger with your eyes.
Knowing someone's history and having their medical records and being able to evaluate what treatment they had is critical. It's really difficult to do this kind of assessment without them. The most important thing is to have records.
Hi, I'm Barbara. Nice to meet you.
Nice to meet you.
You can come back with me. We're going to do your DEXA. All right. Pick an easy one.
Here at the Life Clinic, we provide them with monitoring for anything that we think could possibly be a long-term complication.
Put this comfy cushion under your knees. Feels good, doesn't it?
And what we really like to do is try to catch things early. So we don't want patients to actually have symptoms of a complication when we find out about it. We want to know far in advance of that, because many of the complications, there are things we can do to treat them and to improve the outcomes if we know early on, before a patient even knows that this is a problem for them.
And most of your areas look okay with the exception of the hip. Mm-hmm. There's an increased risk of fracture in the hip compared to age-matched controls.
Every year, the Life Clinic grows by about anywhere from 70 to 100 patients. It's very, very fulfilling. The program grows every year.
Okay, coming down the stairs is really good for your bones because it jars your bones more.
Right. Patients typically come in to see us on a yearly basis, so You get to develop a long-term relationship with people. So I follow some patients for decades.
Need you to lean this way. You're a little tall for me.
At the Life Clinic, we don't encourage patients to completely divorce themselves from coming back to see us because it's a two-way street at this point for a lot of patients. They're decades out from treatment. So they come in here, they know that it's my job to keep up with the literature, keep up with the science, know anything new that's evolving in the field so that they can get that information. But it's important for me too because then I can see how patients are doing decades after treatment. And tell me about any shortness of breath?
No.
Good. I always tell them, you survived a life-threatening disease. That can't be by chance. That has to be for a reason. There's something you need to do. There's something important about your life, and you have to take advantage of that. I think one of the greatest things about being in the Life Clinic, number one, these people are incredible. They have survived something that is so traumatic that most people can't even imagine having to go through. And many of them have gone through them at a very young age when you're supposed to not have to worry about sickness. And I just think they turn out to be some of the coolest human beings I know. They're wise beyond their years. Some of them are very old souls.
The Life Clinic at the Kimmel Cancer Center at Johns Hopkins.